this video, we're going to look at the markers of the ovarian neoplasms. So the questions we want to ask is, firstly, the tumor marker CA125, CA199, as well as the CEA. So what are all this associated with? This will be question 1. The question 2 will be in case of the LDH and PLAB. So this tumor marker is associated with what conditions and what are the pathognomic findings? Lastly, the third question we want to ask is in case of AFP and the HCG. So in such cases, what is the ovarian tumor and the pathognomic finding? So in this video, we'll find the answers to all these questions and learn in detail. So to begin with, we look at the epithelial ovarian tumors. So in case of the epithelial ovarian tumors, it includes the CA125, the CA199, as well as the CEA. So it includes all this. So what is the pathognomic finding? The pathognomic finding. So it includes the Samoma bodies. So the Samoma bodies, it is nothing but the serous epithelial tumors. The serous epithelial tumors. Next, we look at the endodermal sinus tumors. The endodermal sinus tumors. So under this, there is AFP. So AFP, and what is the pathognomic finding? It is nothing but the Schiller dual bodies. Then we look at the dysgerminoma. So what is the dysgerminoma about? So this dysgerminoma, the tumor markers include the LDH as well as the PLAB. The LDH and the PLAB. So what is the pathognomic finding of this? The pathognomic finding is nothing but there is the lymphatic infiltration. Next, we will move on to the embryonal carcinoma. So now we are going to look at the embryonal carcinoma. So what is this embryonal carcinoma? The tumor markers here is nothing but the AFP and the HCG. Then we move on to the mature teratoma. So mature teratoma is nothing but it deals with the AFP. And what is the pathognomic finding is nothing but the Rokitansky protuberance. Then we look at the GCT, that is the granulosa cell tumor. The granulosa cell tumor. So what does this granulosa cell tumor deal with? The tumor marker here is the inhibin, and the pathognomic body is the Call-Exner. The Call-Exner bodies. Then we move on to the Hylas, cell tumor. The Hylas cell tumor, it deals with the Ranke's crystal. Then we move on to the Brenner's tumor. So the Brenner's tumor, the pathognomic finding is the Walthard cell nest. Looking at the Krukenberg tumor. So here it includes the signet ring cell. Next, we are looking at the clear cell tumor. So what is this clear cell tumor? So clear cell tumor, it is the pathognomic finding is the hobnail cell. So now we'll be moving to answering our questions. So the first question we asked was the Tumor marker CA 125, CA 199, and the CA. So what are all these associated with? So they are associated with the ovarian tumor, that is the epithelial ovarian tumor. Now, what is the pathognomic finding? The pathognomic finding is nothing but the psammoma, bodies. So what is this? It is nothing but a serous epithelial tumor. It is a serous epithelial tumor. Then we look at the LDH, as well as a PLAP. So what is the LDH and the PLAP? So this LDH and PLAP, they are associated with the dysgerminoma. So what is the pathognomic finding here? It is the lymphocytic infiltration. Next question we asked was, where is AFP present? So AFP, tumor marker AFP is associated with, here we are just focusing on one ovarian tumor. So AFP, it is for the mature teratoma, and on the other hand, even the endodermal sinus tumor has AFP. So here we are just focusing on the mature teratoma. So what is the pathognomic finding here? So the pathognomic finding here, it's nothing but the Rokitansky appearance. Now we'll be asking some bonus questions which you can answer it in the comments. So the first question we want to ask is the endodermal sinus tumors. Endodermal sinus tumor. So we want to know the tumor marker. Then we also want to know the pathognomic finding. The next question is in case of the embryonal carcinoma. So in case of the embryonal carcinoma, what is the tumor marker as well as what is the pathognomic finding? The third question will be, what is the granulosa cell tumor? The granulosa cell tumor. So what is the tumor marker and what is the pathognomic finding for this?